Hello, everyone, and welcome to our fourth episode of Inside 340B Report, where we bring you inside of our virtual newsroom here to have a conversation about some of the biggest and most pressing topics affecting the federal 340B drug pricing program. So my name is Will Newton. I'm an associate editor and senior writer at 340B Report, and I'm joined here by my colleague Shannon Young, who also is an associate editor and senior writer.
Great to be here.
And we're also joined by our national correspondent, Bella Czajkowski.
Hi, well, thank you.
Thank you so much. We've got a very good episode ahead planned. We're going to talk about three main topics. So we're going to start by talking about some of the emerging trends we're seeing in the types of manufacturer 340B contract pharmacy restrictions. Then we're going to talk about a few key developments in some major 340B lawsuits making their way through federal courts. And then finally, we're going to shift gears a little bit and talk about a really hot topic, which is the upcoming elections and specifically what the outcome of those elections could mean for the 340B community. And I should also note that the fourth member of our editorial team, our CEO and publisher, Ted Slafsky, is out of the office this week, but he is very much looking forward to joining us for our next episode. And so with that, I'd like to jump right in and start with you, Bella. So I know, Bella, over the past couple of weeks, we've reported on two drug makers that have updated their 340B contract pharmacy restrictions. Could you tell us a little bit about those policy changes and what they mean for covered entities?
Yeah, well, of course, thanks. So we've covered a fair bit of news around drug makers putting some restrictions in place around contract pharmacies for hospitals. But the news, this most recent news, has to do with these manufacturers putting on these contract pharmacy restrictions on different types of cover entities. So in the past 2 weeks, we saw Oregon extend their contract pharmacy restrictions to health centers and UCB to all contract or covered entities. We've seen some talk from some of these health centers, specifically one in Athens, Ohio, and sort of a rural area that reported that it recently had to lay off 35 employees due to the contract pharmacy restrictions. And the CEO of the center said that it was a result of a, quote, attack on the 340B program, which reduced their budget and required them to lay off that staff. So we'll definitely keep an eye on these contract pharmacy restrictions as they affect hospitals and as well as other covered entities. I'll turn then to Shannon and Will. Can you give us some updates on the legal developments as of late?
Yeah, so one of the cases that we've been covering since the spring involves a group of Texas hospitals, mostly Baylor Health, who sued HHS Secretary Xavier Becerra over a rule in Medicaid known as the Inpatient Prospective Payment Services Rule that went into effect last October. The rule, among many things, affects how disproportionate share hospitals qualify or whether they're eligible for 340B. And so the group of hospitals sued the HHS over it. It's been working its way through the courts. In August, a judge did a preliminary injunction to temporarily halt the rule. And, while he reviewed the rest of the case, and then at the end of September, he issued a final rule, which found final judgment, which found the rule to be unlawful and halted its enforcement. And so that was a win for the Texas hospitals. Now HHS is appealing that to the Fifth Circuit Court of Appeals, trying to defend their rule and have it take effect. But a key takeaway is that it really hasn't had any effect quite yet. The process surrounding the eligibility for 340B and this rule in particular takes about 3 years to really shake out, and we're only a year out from the rule being implemented. So this could become an issue down the line if the courts take forever to weigh in on it. But right now, it's all kind of a wait and see. And Will, do you want to tell us about any cases you've been looking at?
Yeah, definitely. And I'm very curious to see what happens with this appeal as it makes its way through the Fifth Circuit. And yeah, so once again, and if you've watched our past couple of podcasts, you'll know that this is not the first time this has come up. going to talk a little bit about J&J, although in a slightly different context than the rebates that we've discussed a lot in the past 2 episodes. So a big trend we've been seeing over the past few months is that more manufacturers have been requesting and receiving approval from the federal agency HRSA to conduct audits of 340B covered entities, 340B programs. And we know J&J has been really involved in this because at this point, 5 different covered entities have now sued HRSA for authorizing J&J to audit them. These 5 covered entities, all of which are hospitals, are alleging that HRSA acted unlawfully in approving those audits. And I'm not a lawyer, but from speaking to some people who are lawyers, basically what this comes down to is that in 1996, HRSA issued guidance on manufacturer audits based on language in the 340B statute that essentially said that if a manufacturer has, quote, reasonable cause to believe that a covered entity has engaged in drug diversion or received duplicate discounts, then the manufacturer can provide them with advance written notice of plans to audit them and also engage in good faith discussions with the covered entity for at least 30 days. If no resolution is reached, they can then request audit approval from HRSA. So now these 5 covered entities are all alleging that J&J did not meet those requirements prior to requesting audit approval from HRSA, and therefore HRSA acted unlawfully in approving them. They're basically saying that J&J didn't give them enough written notice, and also that the scope of J&J's audits were very broad and were not really narrowly tailored to any specific reasonable allegations of program abuse. So what happens with these cases and whether or not that sort of affects how HRSA approaches approving manufacturer requests for 340B audits very much remains to be seen.
And Will, can you just talk a little bit about why there's been an increase in manufacturer audits of covered entities?
Yeah, definitely. That's a great question. And the answer really is the Administrative Dispute Resolution Rule, or the ADR rule. So as many of you know, and we covered this over the summer, HRSA's latest revamped ADR rule took effect over the summer. And the ADR rule is essentially the government's process for dealing with disputes that arise between covered entities and manufacturers. So covered entities can file a complaint if they believe they've been overcharged by a manufacturer for a 340B drug, and manufacturers can file complaints if they believe a covered entity is engaged in drug diversion or duplicate discounts, but only if they've first conducted an audit. So manufacturers have to do an audit prior to registering a complaint. Covered entities don't have that requirement. So basically, before the updated ADR rule took effect in the summer, it had been for multiple years, there had been no ADR rule in place. There really wasn't any reason for manufacturers to audit covered entities. Now that the new rule is in place, these audits are very likely a precursor for these manufacturers eventually registering complaints within the ADR process, which then after HRSA makes its final determination within the ADR panels, that would then constitute the quote unquote final agency action on the matter, which could then again be grounds for a manufacturer to sue based on their allegations of this program abuse. And also, we have to keep in mind that the justification for J&J placing its rebate model and other manufacturers that have discussed this model has been that there is program abuse. So these audit requests could also sort of be a way for manufacturers to mine for data that could potentially back up their claims of program abuse. And so that's something that we're very much covering. And now to sort of shift gears, now that we've gotten thoroughly in the weeds of 1996 HRSA guidance, want to talk a little bit about the elections. And Shannon, I know you've basically been kind of our expert in this area. You're working on a big in-depth piece that everyone should read that's coming out this Tuesday, and also talked about it extensively at a recent conference. So yeah, I'd love to hear your thoughts on what you're looking at in the election and how the elections could affect the 340B program.
Yeah, definitely. So we're looking at the election, I guess, in terms of 3 different areas. We're looking at the White House, Congress, and states, because all of those are going to be affected by these results. And it's going to have major implications on 340B policy. So I'm going to take the spotlight off myself a little bit here and ask Bella to talk about the White House.
Thank you, Shannon. I'm excited to talk about the race that everyone is closely paying attention to now. And polls put Trump and Harris pretty neck and neck right now. It's anyone's guess who could win. And not only that, it's going to be days, maybe even weeks before the winner's called. However, of course, we're thinking about the implications of either party's win. And if Trump wins, many political observers expect he'll try to tackle drug shortages and pursue PBM reform. The 2024 Republican platform doesn't actually mention the 340B program, but it does reference, quote, out of control prescription drug costs. Looking back at the first Trump administration, it wasn't exactly supportive of the 340B program, though, and it recommended reining in the program. And they actually cut Medicare Part B reimbursement to 340B hospitals by close to 30%, minding the fact that that policy was later overturned by the Supreme Court. Many of us have heard of Project 2025. It's something that Trump has tried to distance himself from a little bit as of late, but it is by Trump allies and the Heritage Foundation, and it wants to, quote, restructure the 340B drug subsidies toward beneficiaries rather than hospitals, end quote. Trump's attempted, like I said, distance himself from that project, but we'll certainly be interested to see if he is elected, whether any of those ideas shake out during his administration. His VP pick, J.D. Vance, has not said a whole lot about 340B. He did, though, co-sponsor legislation that calls for a government report on 340B and its alleged ties to people who entered the country without legal permission. We've done some reporting on that as well. If Harris wins, it'll likely be considered a win for providers who've been generally happy with the current administration and Biden's moves around 340B. However, Harris isn't particularly outspoken about 340B herself, but she has generally expressed support. She signed a letter condemning the Trump administration for dragging its feet on a final oversight rule requiring the drug industry to post 340B prices on HRSA's website. She also supported the bipartisan letter urging HHS and CMS to carefully consider stakeholder concerns before finalizing a proposal to reduce hospital Medicare Part B reimbursement for 340B purchased drugs, if I didn't lose you there. Thinking a little bit about the track record of her vice presidential pick, Tim Walz, he did sign a bill. He has a little bit more experience one-on-one, or a bit of a track record with 340B. He signed a bill in May that would prohibit drug makers from restricting access to 340B pricing in contract pharmacy settings. However, he also signed bills requiring more 340B provider transparency. And in Congress, Walz criticized the Trump administration policy that cut Medicare Part B reimbursement to 340B hospitals, like I mentioned earlier.
Yeah, so speaking of Congress, I'm going to offer a little bit of preview here of what we're looking at in the House and Senate races. Like the White House race, it's going to be pretty much anyone's guess who is going to win, control the chambers. Right now, Democrats control the Senate, Republicans control the House, both control with slim majorities. And so we expect that trend to continue. Control might flip from one house to the other. And even if one party ends up controlling both, again, it's going to be really tight margins. And so lawmakers are going to have to cut deals, work together, most likely to get anything passed, especially when it comes to 340B. In the House, all 435 seats are going to be on the ballot. One that is of note is that Rep. Kathy McMorris Rogers, who chairs the Energy and Commerce Committee, which has jurisdiction over 340B matters, isn't seeking re-election, so it's unclear who will succeed her. There's a few Republican names that have been thrown around, but there's not necessarily a clear frontrunner. And then we assume that the Democratic minority leader of that committee would take over. But again, you never know. In the Senate, about a third of the seats are on the ballot, so there's 34 seats up this cycle. If Democrats keep control, U.S. Senator Bernie Sanders is likely to remain the Health, Education, Labor, and Pensions Committee chair, and that committee oversees most of the 340B bills, though Bernie is on the ballot. So wait and see there. If the Republicans win control of the Senate, then Bill Cassidy, who's a Republican from Louisiana, is likely to take over as chair. Right now, he's the top Republican, and he's gained a lot of attention in 340B circles in recent years. He's been really outspoken about the program and launched a series of probes that look into how hospitals, health centers, and chain pharmacies use 340B revenue. And some of these were just as recent as September, so we don't expect him to slow down or be quiet on this issue. A few other races in the Senate that we're keeping our eye on are Wisconsin Democrat Senator Tammy Baldwin, who's running for re-election. She's in a really competitive race against a Republican challenger, Eric Holvid. And she's one of 3 Democrats behind the Sustain 340B Act, which is a giant 340B overhaul bill or reform bill, which we're still waiting to see introduced in the Senate formally. We saw a draft earlier this year, but everyone's been kind of waiting to see the bigger bill here. And the 2 other Democrats behind that bill, Debbie Stabenow and Ben Cardin, aren't running for re-election. So regardless of what happens at the end of this election cycle, we could be entering a new Congress with looking for 3 Democratic sponsors, or at least 2 for the Sustain Act. And then another note is Representative Larry Bouchon, who's an Indiana Republican and sponsor of the 340B Access Act, which is a more controversial 340B related bill backed by ASAP 340B. He's also not seeking re-election, so it'll be interesting to see if anyone picks up his mantle there. And the election results won't just affect the next Congress, they're going to affect the current Congress too. Lawmakers are expected to return to DC after the election. And again, they could take up 340B Access bill, they could take up the Sustain Act, they could take up pieces of those bills and throw them into a Christmas tree bill. It's kind of wait and see, and it will depend on how things are looking for either party or who's going to have control. And then also it's going to have implications at the state level. There's a bunch of state house races and even propositions on the ballot. So Will, do you want to give us a little bit of a preview there of what you're keeping an eye on?
I'd like to take a moment to thank our Ultra Diamond sponsors for helping to make this podcast possible. Our 2024 Ultra Diamond sponsors are AIDS Healthcare Foundation, the Alinea Group, Avita Care Solutions, Maxor, RX Paradigm, RX Strategies, and Verity Solutions. You will be learning more about our Ultra Diamond sponsors in the future, but I wanted to make sure to thank them for their leadership role in supporting 340B Report.
Yeah, definitely. So last year in the last state legislative sessions, we really saw an unprecedented number of states pursue bills that would prohibit drug manufacturers from restricting 340B contract pharmacy use. So now that session has passed, actually 6 of those bills became laws. So we now have 8 total states with those types of laws. No, both the covered entity groups and advocates that supported those laws and the pharmaceutical manufacturers that opposed them have all been sort of gathering around, talking about lessons learned, talking about what happened in the states where they did get passed and what happened in the states where they didn't, and sort of gearing up for what will in all likelihood be another and probably even tougher fight at the state level next session regarding contract pharmacy access bills. So as Shannon mentioned, a lot of state lawmakers are on the ballot this year, and that could really have a lot of implications for what that legislation looks like and what those fights look like at the state level. So historically, 340B is sort of a wonky topic that the general public doesn't necessarily talk about at dinner. And so a lot of those bills have involved stakeholders, debating with lawmakers and sort of more behind the scenes activity. But one thing we have seen more recently is efforts to sort of define 340B in a public sense, and specifically to define it negatively. So a dark money group called Building America's Future, which has put tens of millions of dollars into Trump's reelection bid, has also put, and we reported on this recently, a little over $4 million into a super PAC that is specifically focused on 340B and has been spreading misleading claims about 340B being funded by taxpayers and quote unquote subsidizing healthcare for illegal immigrants. So those ads that this super PAC did actually did have some impact in some of those states pursuing legislation. So I'll be really curious to see if this PAC continues getting lots of money. I'll be really curious to see if any of those pads or any of that PAC's ads actually impact 340B races, and also looking at some of the other efforts by covered entity advocates to define 340B in a more positive light. And I think it'll just really generally be interesting to see how this view of 340B and the public eyes battle sort of plays out.
Yeah, I think one interesting test will be a proposition in California that's going to be on the ballot. That is a 340B related measure, and it would require, or it would affect certain healthcare providers that meet a very specific criteria. And a lot of critics say that is kind of aimed at the AIDS Healthcare Foundation, and it's in a retribution for a real estate ballot issue that they're supporting. But it's going to be interesting. It could have a major impact on that group's ability to use 340B funding and discounts. And so, it'll be interesting to see how many California voters understand this topic, whether it gets a lot of traction, and, what the fallout is from that, whether it ends up being something that is, it becomes a litigation issue or spurs more legislative action in California. But it's something that we'll definitely be keeping our eye on.
Yeah, so definitely a whole lot at stake in these upcoming elections with respect to the 340B program. And so with that, I'd like to close up and thanks everyone for another great episode of Inside 340B Report. Thank you so much to everyone who listened and to all of our sponsors at 340B Report. And we look forward to everyone tuning in for our next episode in a couple of weeks.
340B Report is your indispensable source for news and intelligence on the 340B program. We are pleased to offer a special discount of 25% off for first-time subscribers. Go to the subscribe tab at 340breport.com and use coupon code podcast25. I know you will find our news service to be a valuable investment. Thank you.